my name is Kelsey Pinnock, and I'm a DMP student here to perform a basic physical assessment with my patient Melanie. Her vital signs have already been done: her temperature, blood pressure, heart rate, respiratory rate, pulse ox, and as well as her height and her weight. As I walk into the room, I'm going to assess her apparent state of health, her hygiene, and her comfort while breathing. Then, while discussing with her, I will also assess her state of awareness and orientation. I will begin now, but first, hand hygiene. Hi Melanie, my name is Kelsey Pinnock and I am a DMP student. How are you today?
I'm good. Hi, Kelsey.
Do you know why you're here?
Yes, I do.
I'm going to perform a basic physical assessment. I'm going to tell you everything I'm going to do, but if you experience any discomfort or have any questions, please let me know. Are there any specific concerns that you have today?
No, I don't.
Okay, so I'm just going to start out by assessing your skin, okay? So I'm just going to look at your face, looking at the color of your skin, feeling the temperature. I'm going to go down your arms, assess the skin turgor, nice and elastic, and look at your hands, noticing any clubbing, and also the color of your nail beds. They're nice and pink. I don't see any clubbing. Nice, normal looking nail beds. Great. I notice a few moles. No scars or rashes. It's going to go down to your feet as well. Nice cap refill. Less than 3 seconds. Good pink color. Nice and warm. Also looking for hair distribution, but you don't have very much. So now I'm going to move on to your head, okay? So now that I just touched your feet, let me wash my hands real quick. And I'm just going to palpate your head, feel for any lumps and bumps. Are there any that you know of?
No.
Okay, let me just feel up in here, noticing the texture and distribution of your hair. Don't notice any lumps or bumps. Okay. Just going to assess your face for symmetry, your neck. I'm going to feel in your sternal notch here for symmetry of your trachea. And now I'm going to start with eyes, okay? So I'm going to just first start with looking in your external eye. I'm going to look at your corneas. They're nice and clear. Look at your irises and your pupils. I don't notice any opacities of any kind. Your sclera look nice and white. I'm just going to pull down on your eyelids to look at your conjunctiva. Nice and pink. Okay, great. Now I'm going to test for pupillary reaction. First, I'm going to test for direct and then consensual reactions. So I would like you to look over my shoulder, and I'm just going to shine the light from the sides of your eyes, okay? Look for the reaction. Great. Great. Now I'm going to do the same thing and look in the other eye. Okay. Now I'm going to do a couple of other tests for your eyes, okay? We're going to test a couple of different cranial nerves. First, we're going to test cranial nerve number 2, and that's your optic acuity. I'm going to ask you to take a look with your periphery and let me know by raising your fingers when you see my fingers coming at you, okay? Great, now I'm going to do it like this. Okay, and like this. Okay, moving on to cranial nerves 3, 4, and 6. I'm going to test your extraocular movements. So I'm going to make an H with my hand, and I want you to not move your head at all and just follow my finger with your eyes, okay? Okay. One more test is a test for accommodation. I'm going to have you look over my shoulder again, and I'm going to bring my pen light towards your nose, and I want you to focus on it. And now look over my shoulder again. Excellent. Okay, so now we're going to move on to your ears. I'm going to palpate just around your ears, looking at the mastoid bone, the pinna. Do you have any tenderness as I do this?
No.
Just going to look over here. Okay. So now I'm going to pull out my otoscope. And I'm just going to take a look at your tympanic membranes, okay? I'm going to pull up on your pinna. I see a little bit of earwax, but Overall, I see a nice pearly gray tympanic membrane. I'm going to come over here and do the same thing. Pulling up. Great. Okay. Now I'm going to do a couple of hearing tests. This is testing cranial nerve number 8, okay? So this is a vibration stick. I want you to let me know that if you can hear it.
Yes.
Okay. Okay, so now I'm going to do a test called the rubber test, and I'm going to put it on top of your head, and you let me know which ear you hear it best out of, okay?
Both.
Excellent. Now I'm going to do another test called the Renee test. I'm just going to have it vibrate on your mastoid bone, and you let me know when you stop hearing it, okay?
Okay.
Hear it again.
Mm-hmm.
Let me know when it stops.
Okay.
Excellent. So about twice as long. Do the other side.
Okay. Okay.
Great. And then move on to your nose. Just going to start by looking at your septum for symmetry. I'm going to palpate here. Any tenderness when I do that?
No.
Okay. So I'm going to pull out my scope again. I'm just going to take a look in it, okay? I'm just going to be really gentle and look up in it at the mucosa and the nasal passage. Tilt your head back for me. Visualizing your turbinates. Nice pink mucosa. Excellent. Okay. While we're there, I'm just going to palpate your sinuses. I'm going to start with the frontal sinuses. Do you have any sensitivity, any tenderness?
No.
Ethmoid sinuses. And now under your maxillary sinuses. Okay. I'm just going to continue palpating along your jawline for any lymph nodes, palpable lymph nodes, to the supraclavicular area. Okay. Great. All right, so let's just make sure we covered all our cranial nerves. We didn't cover the smelling nerve. So, while testing for patency, we'll double test for cranial nerve number 1, olfactory. So I want you to close your eyes, cover your nose with your one finger, one nostril, and breathe in and tell me what you smell. Okay? Go ahead.
Vanilla. Sweet.
Excellent. Now you're going to cover the other nostril, and I want you to breathe in again.
Cloves.
Excellent. So that was cranial nerve 1. Cranial nerve 2 we tested. 3, 4, and 6 we did. We're also going to do cranial nerve 5. So I'm just going to palpate on your TMJ, and I want you to bite down your jaw. Excellent. Cranial nerve 7, I'm going to have you raise your eyebrows, puff out your cheeks, show me your teeth. Great. Now we're going to do cranial nerves 9 and 10. I'm going to take a look just inside of your mouth, okay? I'm just going to use my pen light. I want you to say ah. You want your soft palate and hard palate. Excellent. You can take a break. Now I'm just going to do a little test. I'm going to look under your tongue, and I'm up for any ulcers. Look at your gum lines, and then also test your gag reflex, okay? Okay, nice and big. Okay. Great. You have a gag reflex. Excellent. Okay. That was cranial nerves 9 and 10. We did 8 with the acoustic sounds. Now we're going to do 11. Just want you to have you shrug your shoulders for me. Okay. And then I'm going to have you turn your head towards my face. Or my hand. Thank you. Finally, cranial nerve 12. I'm going to have you stick out your tongue. Move it to the left and to the right. Perfect. Okay, so now we're going to move on to your lung assessment. And for this, I'd like you to turn this way. Excellent. And I'm just going to start by palpating. How do your Back feel any tenderness? Okay. I'm going to do some gentle percussion, testing for resonance. Nice and resonant, equal lungs. Okay, now I'm going to put my fingers on your back, and I want you to say the word 99 as I move down your back so I can test for tactile fremitus, okay? Go ahead.
99, 99, 99, 99, 99, 99.
Excellent. Now I'm going to put my hands on the lower part of your back and watch for your respiratory excursion. So if you could just take a big deep breath for me. And now, perfect. Okay, I'm going to listen to you 6 places along your back. As I move my stethoscope, if you could just take a big deep breath for me. Okay? Nice and clear and equal breath sounds. Okay, so now you can spin around to the front. We're going to repeat those activities on the front side. Alright, so any tenderness on your chest? Okay, just going to do my resonance testing. Any lower and it's not going to be resonant because of your organs. So we'll move on to tactile fremitus. Go ahead and say 99 for me.
99, 99, 99, 99, 99, 99.
Okay, and now I'm going to listen to your own. Come to the front. Big deep breath. And again. And here. And here. And one more. Great. Now while we're here, I'm just going to start your cardiovascular assessment. So the first thing I want to do is just palpate along your sternum and feel for the point of maximum impulse. It's typically in the apex, but I'll feel down here. Let me see here on your fifth intercostal. If you could just lean forward a little bit. Excellent. Okay, now I'm going to listen to you in a few different spots. The first is the aortic, pulmonic, Erb's point, tricuspid, and excuse me, I'm going to have to get up in here for your aortic, or the mitral, apical pulse, perfect. I'm going to go back again and listen with my bell for any deeper sounds. And again, okay. I hear a great S1 and 2. No rubs, clicks, or murmurs. Just going to flip it over and listen to your carotids now for any breweries. Okay. Alright, I think we're ready for the abdominal assessment. And for that, I'd like you to lay down on this table. Comfortable. I'm just going to lift up your shirt so I can inspect your abdomen. Okay. Looking for any rashes or striae. Everything looks good. I'm going to listen to your abdomen now in 4 quadrants. You must have had something good for lunch. Great, I hear active bowel sounds and no renal breweries or abdominal breweries. Okay, now I'm just going to palpate. Let me know if anything's tender, okay? Great. And pull that down. So while you're here, we're going to do a couple of range of motion activities. We're going to start with your hips, okay? So I'm just going to test to make sure that there's movement in the joints. I'm going to have you bend your, I'm going to pick up your foot here and have you take your knee back. Test your hip there. Okay. And now with your knee bent, you can turn it in. You can abduct and adduct, or the opposite, I guess. You abducted and then abducted. And the same thing over here. So back. Great. And now out. And then adduct. Great. Okay. And while you're here, I'm going to have you maybe scoot up a little bit in the table. And if you could straighten out your legs, we're going to do a heel shin test for coordination. So if you would take your heel and put it up to this knee and slide it down. And then do that with the opposite side as fast as you can, repeating until I say stop. Great. Okay. So now that we did that, we can turn around and we can finish doing the range of motion if you swivel your hip this way. Okay, so we'll start with the knee. So why don't you just extend your knee for me, and down, and this one. Okay. We're going to go to your ankle. I'm going to have you dorsiflex your foot forward, plantar flex down. Okay. Same and same. Okay. And then if you can turn your ankles in and out. Okay. We'll come up here to your other joints. We're going to start with your shoulder. I'm going to have you lift your arms all the way up. And then down and to the side. And down. And then I'm just going to hold your elbow here and feel you rotate your shoulder around in its socket. Great. And then do this side. Just rotate your shoulder around in the socket. Excellent. Now you're going to take your elbows, just bend at the elbows. Okay. And then with your hands out forward, flip them over in pronate, supinate. Okay. Going to take your hands, make a fist, extend your fingers, move your hands up, down, in, out. Great. Okay. We're going to move on and we're going to do a couple more tests here. We'll start with vibration. I'm just going to test for vibration on both your hands and your feet. Okay, so just let me know if you feel it.
Yes. 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 Yes.
Okay. I'm going to test your reflexes. I'm going to start with your brachial reflex here. So I'm just going to put my finger over it. You just relax your hand nice and loose. Perfect. Move to the other side. Nice and loose. Okay. I'm going to come onto your triceps reflex. Just going to hold your hand. Perfect. Hold this one. Perfect. Now your brachioradialis. Just leave your hand nice and relaxed. Perfect. And come over here. Perfect. Okay. Now for your patellars. I know I can get a better one than that. Let's go over here. Perfect. Back. Okay, now we're going to do your Achilles tendon. So I'm going to plantar flex, hit your Achilles. Perfect. And this one. Okay. Finally, I'm just going to have you lift up your foot, and you're going to feel me scratch along your foot. Okay. Excellent. This is your Babinski, and you are negative. Great. Okay, finally, one more test. A test for sharp and dull. So I'm gonna use this Q-tip, and you let me know what you feel. Okay?
Dull. Sharp. Sharp.
Were those sharp pains the same on both sides?
Yes.
Okay.
Sharp. Dull. Dull.
Were the dulls same on both sides?
Yes.
Excellent. Okay. I think we can move right along to the rest of our assessment. That's going to be on the floor. I can help you down. Okay. So we're just going to start with the nose to finger test. So if I'm going to put my finger up like this, and I want you to touch your nose and then my finger, okay? Go ahead. It's okay, we'll do it again, okay? Excellent. One more? Okay. One more test, okay? We're going to take your hands and we're going to hitch your thighs and then turn them up. Repeat it as fast as possible. Great. Excellent rapid movements. Now I'm gonna take a look at your spine. So if you could just turn towards me, there you go. And I'm feeling your spine. If you could bend down, I'll feel it again. No curvatures. Great. You can stand back up. Take a little bend backwards. Okay, stand back up. Okay. Now I'm gonna have you do a slight knee bend, first on one leg and then on the other. So just pick whatever leg you want, your right leg, and then bend down. Great. And now the other side. Okay. Now if you can walk heel toe across the room, turn around, you can come back on your heels, and then on your toes. Okay, great, Melanie. One more test for you today. I'm just going to have you stand with your heels together, eyes closed, and I'm just going to observe you for 20 to 30 seconds. Excellent. Okay, Melanie, you can open your eyes and have a seat. Do you have any questions about today's exam?
No, I don't.
Okay, well, I very much appreciate you being my star patient today, and I look forward to further physical assessments.
Thank you very much.
All right, have a good day.